Now, here we go. This is where it gets controversial, right? And again, normally when I'm doing this in a live class, I will ask for a show of hands, who here runs, who here is currently using kind of a minimalist shoe, or routinely uses kind of barefoot running. What do you tell your patients? Because you hear all over the board on this topic, all over the board. Let's dial down, and what does the research actually say? Because believe it or not, we actually have a decent amount of research that's kind of coming in. This has been going on long enough now where the research is starting to catch up a little bit. So what is it? Well, let's back up a little bit. What is the minimalist kind of running movement? Well, years and years ago, it came out, this huge popularity of these shoes. It kind of started right here on the bottom right with these Vibram. You remember these, the Vibram 5 fingers, they were called. And from there, those were almost a little too extreme for some people. So all of the big name brands started coming out with what they called minimalist running sneakers. Basically, almost no support whatsoever, very, very lightweight. And the two big components of most of these was an ultra flexible sole. You can see on these New Balance here, the slits that go through. So you can basically just roll the shoe up into a ball. No extra support, just a little protection for the feet, basically, and that's it. The other component, besides being ultra flexible, it was usually a zero drop or a very minimal heel drop. Now, what do I mean when I say that? If you measure the height of the heel compared to the height of the toe box, that's considered the heel drop. In a traditional running shoe, like take your old Nikes, Nike Air, Nike Pegasus, there's usually the heel is significantly thicker, right? I'm trying to do this in reverse there. The heel is significantly thicker than the toe box. So you've got this kind of big drop. Now that might be anywhere from, 10 millimeters, 15, 12 millimeters traditionally. Well, these minimalist people kind of shoot for a very minimal to zero drop, meaning the height of the heel is the same as the stack in the front of the shoe. Zero drop, perpendicular. This would be very minimal heel drop, a little higher here. So the minimalist running movement is very, very interesting. It's a great concept in theory, okay? The problem is, I'll hold that thought for a sec. Why? Let's back up even further. Why are they kind of proposing that this is the right way to run? Well, in part, it's to promote what they call a midfoot or a forefoot landing. So these minimalist people are convinced that heel striking, so when your foot first hits the ground, what part of the foot is striking the ground first? These people are convinced that heel striking is the enemy, okay? That we only heel strike because of our modern sneakers and that give us all this cushioning that isn't natural to our bodies from thousands of years ago. And so we're only allowed to heel strike because of these fake sneakers, and it's not efficient. We want to promote where a midfoot, so as your foot hits the ground, the middle or even the front of the foot is hitting the ground first, a midfoot or a forefoot landing. In their eyes, that's much more efficient, lessens impact forces. All the best runners in the world, none of them are heel strikers, so they say. Okay, so that's why they're promoting eliminate the heel striking. So barefoot or minimalist running, it's promoting this mid or forefoot landing. They're claiming it's more efficient, and again, better performance. These Kenyans we're talking about are not heel striking. All right, and again, you can cushion things. It's less impact forces. There's only one problem with all of this, is it's not really true in a lot of cases. All of these things they're kind of promoting aren't really 100% true. It's a lot more complicated than that. Let me go into why and what we're talking about. In reality, even if you want to say it's a great concept, I like the idea, minimalist shoe, and it is. The problem is there's huge injury rates when people try to make this change from a traditional shoe that they've worn for 45 or 50 years, and in the matter of a few weeks or a few months, they want to start running in this Vibram 5 fingers. Their ankle mobility might not be good enough. Their Achilles flexibility might not be good enough. The intrinsic muscles of the foot or the calves might not be enough to handle that extra range of motion and extra load. So even if you want to say it's a great idea, you have to be very, very cautious because if you don't take it, and even if you do take it super slow, you still see a huge rate of injury. Okay, you have to make sure you're addressing these weak spots: intrinsic foot muscles, ankle range of motion, big toe dorsiflexion range of motion, calf strength and endurance. All of that needs to be a consideration before you even think about switching over to a minimalist shoe. This is the key takeaway. Stop focusing on how your foot hits the ground, meaning midfoot or forcing a midfoot or a forefoot strike. Stop focusing on that and start focusing on where your foot is hitting the ground, meaning don't be an overstrider. Okay, let me break this down really, really quickly because it's one of the sorry guys, it is one of the crucial points of this whole talk. Okay, what I mean is this: if you're looking at me running from the side, what we've been just having pounded down our throats for the last 5 or 10 years is that heel striking is the enemy. Where they're getting confused, and I've got a slide that's going to show this in a minute, but where these people are getting a little confused is that it's not heel striking that's the enemy. It's heel striking when you're overstriding. That's the enemy. If, like these elite runners, you're not overstriding, your foot's hitting the ground perfectly underneath your knee, who cares if the heel happens to hit the ground first? That's what we now know. Who cares? Okay? As long as the foot is under the knee, let the part of the foot that ever comes natural to you hit the ground first. That's the takeaway. Whatever foot strike comes naturally, as long as you're not overstriding, that is ideal. Period. End of story. All the big names in this field are in agreement. Stop focusing on what part of your foot. Start focusing on where your foot is hitting the ground the way it wants to, under the knee. Okay? So that's why elite runners might be heel strikers, forefoot, midfoot. It doesn't really ultimately matter. Your body is going to choose the foot strike pattern that fits you the best. Just don't overstride. The research is pretty clear that there are two types or two groups of runners that you might suggest try. Not only I put a minimalist shoe here, but what I really mean is that might have success trying to switch from a heel striker, if they are, to more of a midfoot strike. And a lot of ways to do that is with these minimalist shoes. Does anybody want to guess? I'll give you a couple seconds. Which type of runners might do better being midfoot or forefoot strikers? Well, chronic knee pain. So I'm not talking about just like someone flared up their IT band. I'm talking about chronic knee pain. You know, the big one they usually research is osteoarthritis. You know, these are the people with really shot joints, future knee replacements, significant long-term tendinopathy, patellar tendinopathy, things like that. What these studies have shown is that a midfoot, forefoot landing does decrease loading force at the knee. Pretty consistently, it does do that. Now, it also, a forefoot, midfoot foot strike also dramatically increases loads at what? The foot, ankle, and calf complex. So that's why you see these people that switch to minimalist shoes, they're always tweaking their Achilles or they're developing plantar fasciitis. You're just passing the buck. Okay? Passing the buck. But if you've got your chronic knee pain person, they've tried everything and they just love running and want to keep running, they might be one person you say, hey, let's try this. I want to see if we can get you striking a little differently. Okay? And the only other group that I would really force or strongly suggest switching what comes natural are the people that are always hurt. Literally, they come in 1 month, it's a left calf. The next 3 months later, they're in with a right hip issue. Then it's the left plantar fasciitis. And they're all over the board. Nothing is working. They're always hurt. Give it a go. What do you have to lose at that point? Maybe you suggest, let's totally mix it up. Let's try a little minimalist shoe after you try to strengthen the calf and Achilles. Take it really slow. Those are the only two examples that I would say.